gal's scared, so I really wonder what's going on with her baby. She said, we have a new kitty in Tacoma waiting for oral meds. Why oral? Do you have a vial? You could help her with first injection. She should always start with the injections first, never the freaking oral. Why? Yeah. Because it absorbs in the body faster.
Oh. Okay.
Versus going through the stomach and then through everything.
As long as she's not horrible, you can go with oral. But she's horrible.
She's, from what it sounds like, she's horrible. She's also not eating, so I'm going, yeah. So, yeah. Hi, new FIP kitty coming.
Today? Yay.
Yeah, well, she's not ours. She belongs to...
Where'd you get that shirt? I want one.
I need to find out, see if they have one for Dad's father of cats.
All right, baby.
That'd be cute.
There.
Oh. I have one right there. Thank you. You're too funny.
Alexa, turn it down.
Oh yeah, definitely.
Alexa,
we're on YouTube.
Down,
Okay, so what are we doing? What's with this one? The soul.
Alexa, turn it down. Alexa, there could be no breathing. Don't breathe.
Part of that's TikTok, actually. I really wish we had freaking read out on here. I do.
I wish we had.
I went into the nursery earlier this morning.
Oh, I cleaned it. Not cleaned the nursery, but I cleaned the litter boxes. They were exploded.
Oh, yeah, I didn't do that. I just picked up the
No, you didn't.
plates. And...
Trust me.
He's mean today. He's mean today.
Thanks for... I'm not being mean.
He's mean.
Thanks for picking up the plates. That was a tough one.
No. Okay, so plates and whatever other stuff. But then I also did the CH pen that had...
Oh, that's why it's clean.
Yeah.
I was wondering, I'm like, you guys have been good?
Yeah, no. Well, it's not that they're not good. It's just that they have poop.
They're evil little kitties. They wait till we go to bed, and then they're like, all the shit on everything.
No, they just say, let's evacuate our bowels now.
Let the games begin.
The games begin. Okay.
Okay, boxes don't go in there.
That kind of box does.
That's for potty box.
No, those are not. We've got ones that are just that high that are an actual potty box. Those ones are too big, and they're really small compared to the other ones that we have. So, sorry. Okay.
Yeah, I was up at like 2:30 and I just couldn't sleep.
Earlier he said he was
You
up
were
at 3.
snoring like a...
He was not. He was passed out.
You heard her. So I came down here and I watched my Bigfoot shows.
Okay, hold on a second. This is the FIP kitty. Okay, I've got to just start talking or something. I've got to start getting info on this gal.
Hi, my name is Tim. Good morning, everybody. What are you doing? Hi, Ozzy. Ozzy Trace. Okay, I need to go to the restroom.
Alexa, pause. Wow, I addressed it to Poppy. Poppy is the cat. Oops. Okay, so I was just contacted by FIP Warriors to help a gal out whose kitty just was diagnosed with FIP. I don't know if it's wet or dry or anything, or if it's neurologic, not a clue. I'll have to assess that. All I know is newly diagnosed, for some reason, is waiting for oral meds. Don't know why, but because it's always best to start off with the injections. They absorb into the body way faster than the oral meds. Oral meds have to go into the stomach, then get processed. Da, 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 da. Anyways, and on top of it, she's not eating, so I don't know what else is going on. Um, I want to know what her red blood cell level count is, what it looks like. If she's considered anemic, I want to know the numbers. I want to be able to tell them, hey, let's get them to a vet and let's get a blood transfusion going. We'll pay for it. Um, Frog Dolphin, I would suggest greatly that you actually get glasses or get your eyes checked. I look nothing like that person you stated. Anyways, I had that removed because to me it wasn't appropriate. Anyways, haven't seen iPhoto yet. Video, walking video sounds. Uh, yep. Cool. She's now on. Good. Okay. Da, 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 da. Yep. Wet FIP. Da, 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 da. Okay. And I'm going to do this back to here. Da, 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 da. Okay. So I just let her know, send me a copy of the blood results because depending on the values, we might be going on a field trip. Not wanting to move. Okay. Okay, here we go. Damn. Sorry.
You're sorry. You're fine. You're doing all the work out here.
Shush. Eyes abnormal. Squinting, conjunctivitis, but right eye. Oh, okay. All right. So where are the blood results? Okay. What? No fever, which doesn't necessarily mean anything, but usually we also see fever off and on. Okay, well, that was fun.
Come on, Tim.
Okay.
Hey.
Oh, yeah, she's a little neurologic. It looks like not bad so far that I see. Okay, kind of hard to tell. Good golly. I'm gonna have to delete a crap ton of stuff. Okay. Oh, there we go. Okay. HCT, she's at 36. Okay. That's not horrible. Okay, she drank and ate a little liquidy treat, but she did it today. Okay, so that's good. We just need to get her feeling better. Okay, so hi. Yeah, please don't forget to like the live. Sorry. Usually I'm like running all over. By the way, thank you for the gift. I'm so sorry. Um, there we go. Oh, Lakshmi, hi. Oh boy. I am among one of many FIP warriors. FIP is feline infectious peritonitis. It is not contagious. It sounds like it is, but it is not. It infects their entire body and it can take their life really quick. It does derive from the feline coronavirus. Most cats are either exposed to, born with, or has had feline coronavirus. Much like chickenpox, once they get it or exposed to it, their bodies will hold on to it. And then what happens is, under the right stressor, which is subjective to what the cat's body says is a stressor, it can genetically mutate into FIP. And it'll either go wet or dry. Wet is a lot easier to identify because it's called an infusion, where the body starts pulling liquid around the organs, especially around the abdominal area. Um, some vets will take a needle and will take some fluid out. Others will not, because what is less of a biohazard going in is better. So it all depends. Some vets will try to take as much fluid out as possible. Um, I still disagree with that, even though I've argued with many higher up vets regarding that. Um, I know what I've researched and everything I've heard from other FIP cat humans, cat humans who have had a cat with FIP. Their cats went into shock and passed. Um, they say, "Oh no, it's safe." I don't trust that with everything that I've been hearing. No, so I disagree with that, but that's just me. It looks like you're only 30 minutes, but I would need to get gas. That's not a problem, so I'll be there within the hour. Perfect. So I'm going to get, let's see here, her cat is how big? I wanted to say it was, of course. Um, 2.58 kilograms. Okay, we're going to go on a field trip. At least the kitty does not need to have a blood transfusion. That's something that I was worried about. She's just worried about her kitty because she's not eating or drinking, and I get that. She's a little bit neurologic, but that's because she feels like crap. So let me get cat bladed. Not that one. There we go. Okay, so you know, it just helps if I don't do that. Desktop. FIP tips. Okay, I'm just getting this started up for her. She's going to be here probably in about 45 minutes or so. And I need to make sure she's set. Yes, take bring the kitty. Okay. And you are, again, 258 kilograms. Um, once a day. $2.58. Okay, so 0.5. Good morning, good morning, good morning. Hi, Kitty Perfection. So what I'm going to do is make up her little chart. 2.58, which means she is 0.5 mils. This way she can go with this. Okay, she's going to start on 624. "84 days of wonderful stuff." She's not going to need the injections the whole time by any means. 8-4, so it starts at 8-5. But I still do this because she still needs to know when to get the blood work done again. Whoops. You are soft. Okay. And the one sheet, that's good. Okay. So she's going to have 0.5. That's not very much, which is fine. She's just a smaller kitty. She looks like she's going to be a bigger kitty. So, what I'm going to do is get a bunch of stuff together for her. Hello, guys. So, 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8, 9. You can go with 15. So it's today plus 2 more weeks. And she's probably not going to do that. She's probably going to do it just as much as she can get away with until the oral meds come in. And that's fine. That's up to her. Again, it's best to start them off with injection. I have oral meds. I'm going to go there. So, for now... Actually, I'm going to leave that in there. So 0.5. I need to find out when is her... Okay, now I can't even give her the assurance that I've never lost an FIP kitty yet. I haven't lost one here, but somebody did bring one to me that was so far gone. Yeah, that sucked. Let's see here. There's that. There's this. 0.45. 0.5.
Totally on their way over now.
Yeah.
Yay.
She sent me a copy of the script. That was adorable. Okay, so I'm going to make sure she gets a little bit of this. And 20 mils. Okay. There's this. So she's going to get some 20 mil needles.
she gonna give it a shot?
I'm gonna teach her how to do it.
So it's just her?
Why? I don't know if it's just for at home. I'm not gonna get that for. Are you alone?
Are you alone? Do you sleep alone?
Do you sleep alone at night? No. That'd be creepy.
I'll get that information. Do you sleep alone?
Yeah, let's not do that. I'll need to give her some gloves, and I need to figure out a thing. I need little containers. Just little containers, just enough for her to, yeah. Because I don't want to give her my entire tube of meds. Well, I guess this one is okay, because this one's almost used up, so.
I see it.
What? No.
I'm gonna fix it. No, you can't do it. Give it to me.
What are you gonna do?
Give it to me.
Describe what you're gonna do.
I'm gonna sleep alone with it. Give it to me.
You're so creepy.
Come on.
Can I
Everybody's
trust you?
doing it.
No, they're not. No.
Yes, they are.
No.
Jill's doing it.
That's Jill. Don't push it out to. No. Hey.
I'm only pushing it.
No. Okay, no. You know why? No, don't.
You like that?
Okay, stop. You know why? Okay, if it's metal, if you do that, once you open it, it's gonna go. Don't do that. For a second there, I thought that was actually
So
good.
you'd rather watch him struggle?
I'm not gonna watch him struggle. I'm gonna put it on the first time so I can show them how to do it. After that, they're not gonna be struggling because I can't see it.
You roll.
No, you don't. It will go all out. No.
You don't do it tight as you can up to the top. You gotta have a brain. Do you sleep alone?
Yes, I do. Don't touch it. Okay. You are just wonderful. Okay. Get in a little bag.
It's Jill's fault. How many needles?
Okay, hey, there's no kibble up here. Here. No, I didn't. It was eaten because it was on the floor. So please put it back up there. No, yeah, you're not funny. He is so not funny at all. Period. No, got it back. Okay. Okay. So awesome. Okay, so.
Where?
Up where what?
The food bowl.
It's not.
Oh, it's in the cage. For the love of.
No, once Snowball got into it, I took it the fluff out of there.
He needs to just stay in his kennel.
No. He does today because he's not feeling good. But he is doing better. So Snowball is feeling a little bit better. Oh boy. Yeah, I do need to watch him. Okay, so that'll be interesting. Yeah. Did you already feed little buddy Dookie?
I did. And I gave him his meds.
Did you?
All of them.
Those?
All those.
Okay, did you give him the lactulose?
Yes.
Okay. Thank you.
0.8.
No, what? You're not even. He's not funny. He's got jokes today. I've got. Jeez. Yeah. Okay.
Okay.
I'm still trying to figure out in my head what the hell am I doing.
Me too.
Mm.
Okay, bitches.
Okay, so I have one of these. Actually, there's two of them in there right now, but I have one ready. I have a treatment log.
You're a treatment
She won't be needing the whole thing, but it is always good to see day 84 is September 15th, so that way she knows. Hey, and I've gotten yellow or red, orange, whatever. Jill, thank you. You guys like the gift. He's a cute little chickie.
It's all Jill's
He's a ducky. It's a duckling. It's not Jill's fault. So she needs to set up for another follow-up blood work. But she also needs to give me her email address so I can send this to her via email so she doesn't have to have it electronic. You know, she doesn't have to have it just physically. It's going to fit in there. It's going to fit in there. Oh. And because her baby is not eating, that is why I'm doing the Mirataz. Now, the vet should have given her some, but that's okay. Luckily, I have that much extra still. I have a whole other tube upstairs that I've been using on Snowy Snowball. But I want to, before I open this up and separate these, I want to show her that it is not open yet.
Is that too much noise? They're gonna...
Not at all. It's good. Oh. And gloves. These gloves.
You need a farm for gloves?
Nope. Not on tube.
Exactly.
Even 2, 3,
You do
4, 5. I guess I could do 7.
There's 7. Okay.
6, 7. Is that whole week? You shouldn't need that many, but you know, who knows. All right, we are ready to go with that. Done. What was I doing these? Yeah, right, Jessica? He's not doing fantastic. I started doing the Mirataz on his ear because I noticed, hey, you're not eating. And I need to probably give him some sub-Q fluids. I'm constantly trying to keep his eyes opened. Otherwise, they glue shut. And now it went from me using the typical, okay, I'm going to use the paper towel, warm it up, and I'm just going to put it on his eyes. And his eyes have been gluing shut so fast. I'm going, okay, I can't even do that because it's going to start making abrasions. So I've got to switch over to the other way, the cotton squares. Yeah. Oh boy. So, okay, I guess I'm not going to worry about this anymore. I think she's on her way. Oh my God. Okay. So, if you didn't know who we are, oh, where you've been, chances are everybody knows who I am now because there's only 38 people in here. But my name is Shar. I'm the owner of Critical Care Kitten Coalition. We are a medical rescue, which means we are a rescue for the rescues here in Washington State. We take the ones that other rescues and shelters would euthanize. And vets utilize us for the same reason. If they can't find placement for a sick or broken kitty, then they contact us. Generally, the kitties have something very contagious like Pan-Luke or some crap like that. So, broken ones could be anything. We just always hope that they come here and are still alive. That's the only thing that I really hope for. Yeah. Wow, that fills this up way too fast. Let's not do that. I'm wearing one slipper because I will have the other one down here. Okay, other slipper. I knew where my other slipper was. Okay, yay, now I can slide. All right, so Winnie and Eclipse. Winnie and Eclipse get, I always forget what it's called, Famseek liver. Shoot, Tim, did you give Snowball? See, this is why I only like being the only person. You would what? Okay, I will go upstairs and do his meds once I'm done with these two. Huh? You calm down. Made sure that they have a radio in here that they can't touch. Okay, come on, let's move it, move it, move it. Hi. Hi. Why does it smell so horrible in here? It doesn't look bad, but it smells bad. Why? Yeah? And you guys keep unplugging that. That's great. Okay. I need Winnie. No, no, no. Twilight. No, no. There's Winnie. 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 He just throws the freaking plates everywhere. I don't. I have a method. Come on, guys. Okay. You. This guy. Eclipse. Wow. Num num. Num 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 num. They love the lysine. I gotta say, it tastes just like roasted chicken. That's what's so funny. This is Winnie. Winnie, Winnie, Winnie. Come on. Winnie's getting big. Nom, nom, nom. This is always fun. There we go. I can hear water low, so that's going to be another thing. So we have those two meds done, high tot. We have a whole bunch of kittens in here, and then we've got a few very shy ones up there that I'm waiting for them to get out of their system of it being, uh-oh. Oh, no, no, no. No, 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 no. Uh-oh. Okay, excuse me. Buddy, buddy. Holy shit. Tim? No, come on, move. Okay. Hey, Tim? Oh, yeah, you can finish a task. See what's wrong with this picture?
Okay, yes, dear.
Come here. You tell me what's wrong with this.
Oh, baby, you got sick?
Yep.
What the fluff?
I think we need to
Definitely on the meds.
set up. Yeah.
Oh, baby.
We need to set up their. We need to weigh them, but we also need to set up their playpen so they don't spread it all over the place.
Well, you can go on with little.
No, no, no.
You can all play with Ella.
Let's not do that.
And you are 111.5. You are sticky thick.
Yes, and it's only these two. I'm wondering about the others.
Oh, it's gonna spread around.
It is.
No doubt in my mind. Poor babies. It's all your fault.
You're the one that went in there and fed them, and you didn't even notice.
No, there's 32 cats in there.
There's not 32 cats in there.
Meow, 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 meow. Where were they? Up on the tree?
Nope.
No? They were running around?
Nope. They were just. He was lying there.
You guys charging it up?
Nope.
Huh? Were you laying on the floor like, oh, I'm dying. Help
No,
me.
don't say that.
Help me. You're so cute,
Hey,
little
chill.
babies. Little babies.
Okay, so what is that one's weight? Who is that one?
111.5.
Let's buffalo this.
Is it?
1.
That's all right. I'll spend all day snuggling with them.
And you are
All day.
Hurt. Hurt is 111.2.
Wow.
Here.
Oh, Bert and Ernie. He said beep beep. Oh, beep beep. You sit there. I gotta clean your sister off. His mom did.
And it stinks in there, so there's poop somewhere hidden. Not in the litter box. It reeks.
Yeah, baby. I'll get you something. Mama didn't.
Mama didn't, because Mama's busy. I know, right? Poor little ones.
We need more.
Are those the Fosters? No.
No.
No, this is the Sesame Street group.
Can you tell me how to get to Sesame Street? Sunny days.
Okay.
Okay.
Oh, yeah, he's not even done. Okay. Hold on, I got him.
How to get through Sesame Street.
Careful not
Hey,
to.
baby.
I would hold it there so it can actually work its way to
There we
being
go.
softer.
Okay.
Yeah, no, it's not.
Okay.
No,
Okay.
no, it's not. Hold on.
Okay.
Black one.
Sunny day. Chill, baby, chill.
Stop it.
Hey! I'll put it back in there now until we can get this thing set up. That was good.
Wow, he's just all over the place.
Who?
You.
Why? I put the cat back.
Medication.
For?
Eyes. The fluff?
It's
Where's
upstairs.
the fluoxetine is
Yeah.
upstairs?
Yes.
You get
It's
it?
for Snowy Snowball.
No, not the. No, he has
Oh,
tobramycin.
woman.
Actually, he has a different type that's in the bathroom now, so you can bring both of those down. No, because you know what, Tim? These little eyes, they deserve it. So throw up, punch yourself. Not feeling good. Yeah. We'll get you better quick. We'll get you better quickly. I'm sorry. Gosh dang it. This is the only reason why I don't like them all in one space, but at the same time, it's like, how did they get sick? Shared air system will do that. And the whole building is one shared air system. That kind of sucks. Okay. Here, hold on a second. Now I can be able to read some of these. Hi, Vicky. Hi, Sarah. Da 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 da. Mahela? Mahela. I'm hoping I'm saying that right. Hello. Brenda Dangle, hello. What's this one's name? This one is Fluffaluffagus. Okay, so she'll be here at around 10:15, so it's about 20 minutes. I know, 15, no, 20, 25 minutes, 25 minutes. Oh, that's cute. Okay.
So I'm getting fucking nauseous.
But you can have, okay. No, no. We do not want you going over the edge. No.
That's your dish.
Here.
Oh, God, John.
Yeah, there we go.
And the baby.
Yeah, we need to get the other one back in here. So, okay. You're just cute. We need the other two to see if they're also sick. Chances are they are. And I'm wondering if it's from Mama. This is, wow. There's also Cookie Meowster.
Great.
Yep, I guarantee Cookie Meowster's also sick. This one's 115.3.
The biggest so far. Let's see if I can round up the other one.
Here's the other tabby with half white boots. No, that's it. Oh, well, I need to do his eyes,
He
yes.
looks good.
We just cleaned, yeah. Yeah, they're a bit feverish too, I can feel that.
Yeah, feverish. Little baby. Yep. Poor babies. This is little baby.
Yep,
All three.
just a one low grade fever, but yeah.
They're babies. Jill's fault. What the?
What the what?
I love you all. I love you too. Love you long time? Is that what you were saying, Char? No?
No.
No?
That was cute though. Okay, let's take a look. I know you got a nasty nose and nasty eyes, and we're gonna get you all feeling better. Okay. We're gonna need to clear some of this off so I can do the injection on that
I'll
one.
gladly clear all this off.
Hold on.
You've already had yours, baby. You just need eye injections.
Not injections.
Look at that. Check it right.
Eye drops. My God, eye injections. Ew.
Oh, your baby.
Hold on.
I get my baby.
Yeah, well.
My baby.
Good God. Talk to me before you start grabbing them. Okay, there's that. Okay, you don't know which other one to get, do you?
What do you mean? No, I don't.
Okay. All right, I'm going to use this one. And you are Fernie. Fernie is going to start on lysine right now, so is the rest of them, but you keep taking them back so damn quickly that I can't do everything. And, oh, Jesus. Shush.
Jesus.
Quit saying that.
Go pee pee.
I know, honey.
You're going to feel better in 2 days.
They will probably feel better within the next 24 hours. However, that doesn't mean that they're going to be well. Come on. So if you're just joining, my name is Shar. I'm the owner of Critical Care Kitten Coalition. This is going to be fun. We're a medical rescue, so that's even more fun, right? Tim is trying to find Cookie Meowster, but he doesn't know which one's Cookie Meowster. But he is going to annoy every one of those poor little kitties by doing that sound. One, two, three, four. Okay. There is the Clavamox. There's the other three for the lysine. Oh my God. It's better if we did it all at the same time, so we're not playing this back and forth crap, but whatever. Tim? Okay, the two that we've already given, three. Okay, I've already done. No, don't. Tim likes to overwhelm me really quick. He finds it funny. I don't.
No, I'm not trying to overwhelm you. You're just racing off and you're
okay, there's one that we've already done.
Yeah, I'm trying to find the other one. They just kind of booked it.
Okay, it's the two little tabbies. Okay, there's that one.
Now those two are done.
And if history has it, Cookie Meowster is only going to be 1.5 pounds. Okay.
And I don't know who the other one is.
The other one looks just like this one, but their boots are half white. Look.
Oh, that was adorable.
Adorable.
Adorable, Edie. You're bitter.
Okay. Let's see if he knows which one it is. Okay. And that's garbage. I don't reuse syringes.
Is this the one?
Yep.
She doesn't look sick, but let's don't take chances.
Well, let's. No, I'm not going to give them antibiotics if they don't need it, but I will do.
Lysine.
Yeah, 1.8. I'm literally 1.5 pounds. 1.8.3. Yeah, you want to give him this one? Okay. So, Ella needs Okay, we need to weigh Ella and get her meds. Can you get Ella? Thank you. What meds are you giving them? Clavamox and lysine. Put this away. Oh, and tobramycin for in the eyes.
125. Yeah. Ugliest cute kitten in the world.
She is not
She's
ugly.
so ugly cute. Her eyes are looking everywhere but straight. What's that? Is that her stuff?
Almost. I know. There.
Thank you. Yeah.
Okay, so have so much crap here. Tobramycin stays out. Fluoxetine goes away. That stays out. This goes away. That goes back. What you looking for?
Nothing. The meaning of
I
life.
was waiting for you to say that.
The
Oh
meaning
my god,
of
you are so predictable.
Life. Zatch. Biz. Don't even know.
Okay. These are the active meds. This is gone. There's a little bit left, I guess. Okay. Did you give him this yet today?
Yes. In the morning. I give it to him in the mornings with his food, along with everything else.
This goes straight into his mouth. Don't put it.
Yes. I wouldn't joke about my Dookie Duke. Yes, all the litter boxes are done. Except for the
Even
dungeon.
dookies.
No,
Well,
Duke.
get the dungeons.
I get that. Uh-oh, there it is. Where's your house?
Hello. Appointment confirmation for Wiggles.
Sorry. All right, babe. Penny. Suck it, Penny.
This better not. This will be the last appointment for Wiggles if they say the same freaking thing.
Wiggles is doing good. She's playing, running around.
She's always playing, running around, but she tends to run around in circles. That's my issue. And had she not been doing that, I wouldn't have known that she had a double ear infection. The last time I took her in, one side had cleared out, the other side was still infected.
I'll be back.
They're talking about surgery, and I'm going, surgery for an ear infection? Oh, Chef and Winnie get vaccinated today. No. So many vaccinations all the time. Okay. So Tim now went upstairs. He abandoned me. Abandoned me. You abandoned me. Yeah, in about an hour or two when I'm off. I know him. JD! How's Dookie doing? Dookie's doing good. Jeez. I don't know why that's sitting there. Da 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 da. So ridiculous. Whoa, that would have been bad. Our enema stuff. That one's open. I don't want to do that. I thought I had ordered another 6. I did not. I clearly ordered the one of 3. Not happy about that. I need to order the one of 6. Because otherwise I'm going to go through these really quick. Okay. He said he didn't clean out the litter box in the nursery or in the dungeon. Dungeon girls are doing really, really good. Okay. This is why I generally am off by this point, because it's like there's so much to do and all I'm doing is running back and forth and it's just ridiculous. You have 2 cats? Hello, hooray, hi. Did you just get 2 kitties? Is that it? Hello from, is that Great Britain? I really suck at the flags. I always have. My apologies. Okay. Jeez. I told him, hey, we need to clean this up so that we'll have this ready by the time the gal gets here today. He says, okay. And he goes and leaves. Love it. Okay. Not exactly sure what that's for. Okay, so right now I'm just trying to clean up, and I've got no Tim. Okay, so I am debating on shutting down the live for this. Oh, jeez. All of this needs to just be cleaned up and gotten rid of or something, put away. This has been sitting up there for far too long. Some of these wonderful fountains are not that wonderful. It all depends on how easy it is to clean up. Or change the filters or anything like that. And some of them are just a pain in the absolute rear. Some I would never recommend at all, period. This one being one of them. This is from One Is All. Don't do it. Jeez. I will deal with all of that in a few. This is going to go away. There. There's the other one I was looking for the other day. Isn't that cute? Okay. Cheese and rice. I have cat toys up here. I have filters and a card. The Nom Nom Shop off of College Street. I'm interested in how easy it is for my cats to knock a water fountain over. It all depends on the water fountain. And let me tell you, the girls in the dungeon, they have been able to knock over every freaking fountain there is. It is absolutely irritating. It could be as square and solid as ever, and they still somehow knock it over. No matter what I do, everything seems to just grow. Wow, okay. She should be here anytime. Yeah. Really? Okay. Okay. Putting these a flippin' away. That must have been also to say, hey, give Winnie and Chef their vaxes. Third vax I need to see how old they are to see whether or not they're going to need a fourth one. Okay, as much as I hate it, I also miss having a bottle baby. Yeah, that's Penny. Penny is a talker. Penny is adorable. Everything is so disorganized still. Slim husk goes over here. Okay. Is Penny still in detention? If you see Penny out and about, she's not in detention. Which she wasn't in detention. She was getting retrained on how to use the litter box. I guess you could say that is kind of a detention of sorts, but yeah. Here she is. Let me find out if she's okay with being on camera. Right now we have 61 cats and kittens here.
Oh my goodness.
Yeah. Oh my goodness is right. Okay, let me get a towel for your baby.
So, did they have her? I wasn't actually positive on her weight. Was that information on there?
Yeah.
Okay. Sorry, I've been like crying.
You're fine. I get it. I have been.
Oh, honey. Really, it's going to be okay. It is going to be okay.
It is going to be okay. Just keep saying it's going to be okay. I looked at her HCT levels. I looked at everything. She's going to be fine. Let me get this. Let me take care of this.
That suck.
I'm kind of irritated with the fact they didn't give her Mirtaz if she's not eating. So
I don't. I did get an appetite suppressant the next day.
appetite suppressant or?
I mean, no. Stimulant.
Okay, what kind of stimulant?
And I gave
Ooh,
it.
I don't like that one.
I gave. Shoot. I wish I would have.
That's okay.
I could have my daughter.
Is it topical?
It was one I put in her ear.
Yep. Okay, good. That's the same one that I have. So
I did it yesterday and this morning.
Yeah, do it once a day. Switch ears. Did they tell you to
Yeah,
switch ears?
yeah.
Do you
It
wear
was-
gloves?
No, I use my fingers and.
It's gonna affect you too.
Good, because I haven't been eating. That's what I said to my husband. I was like, oh, I hope it makes me have an appetite too, because.
It will, but you're probably gonna go, oh shit.
Maybe I'll be hungry later.
We'll just do it this way. Okay, so you have somebody there to help you. Well, that is good. Let's see here. I'm trying to. So here's your goodie bag essentially. Now I know that you're getting
Yeah, I
oral.
am getting the oral one. I did like overnight, but then I'm like, this all happened.
Well, here's the thing. Oral has to go through the stomach, right? And then it gets processed. Injection, it goes straight to the system. So it gets absorbed a lot more, a lot faster,
Yeah.
and they have results a lot better. but it sucks. And you're gonna really hate what I'm gonna have to do to your cat at one point because they're gonna get a haircut.
Oh yeah, she's already gotten haircuts, so
She's gonna get a different one. She's gonna get a mohawk. Okay, so because you got to, you have to alternate the placement. Some of the medicines sting. This one doesn't seem to sting as bad, although Penny disagrees. But Penny is over dramatic. Hey,
Oh yeah,
Penny.
see, it was 2.58.
Yeah.
I mixed up the 8 and the 5 and the
You're
8.
fine.
Okay.
So she's actually gonna get 0.5. I'm giving you a bunch of these. You don't need that now. I'm gonna give you some gloves though, so you can not have to deal with the appetite thing so much. It's best to keep the medication in the fridge. So, yeah, you're gonna see this. You go, nope. She's already survived FIP. She's also survived panleukopenia. The hell?
I'm just worried about giving these injections myself.
Well, you're gonna need your husband to hold her, and I'm gonna show you how to do it. And if you want to, you can. If you've got the time and the ability, you're welcome to bring her down here every day until the medication comes. That's fine. Or if you want to, however long you want to. But
Yeah.
this also shows you
okay.
when the 84 days is up. That's the other reason why I keep kind of doing that.
Yeah, that's what I was talking to my girlfriend on the way here. She's like, "Do you want me to come for support?" I'm like, "I feel like this lady's gonna be really supportive. I think I'll be good." But I was like, she might even let me just drive to Lacey every day if
you need to, absolutely. So we'll see how it goes. It is a bit of a shock, and it'll also depend on how she reacts. Sometimes they're like, no big deal. Other times they become Penny, and oh God, that was the worst 2 weeks ever. And her HCT levels, that's what I was looking at on the blood work, is her HCTs.
Okay.
If they had been in the teens, we would have been going to Blue Pearl and I'd have been asking for a blood transfusion and we would have paid for that. It's not. She's 36. She's fine. I had one that had 9.9. She required a blood transfusion. Penny's was...
I mean, the doctor yesterday just made me feel like I was going to lose her. I'm just like, I don't know. He had horrible bedside manner.
They usually do. But they also tend to go, oh, FIP, yeah, you're going to have to put them down. What? Why? There's... No. Yeah. In fact, I tend to argue with the vets when they say, well, it could be anemia. Yeah, it could be. It could be flea-driven anemia. I keep them all on Revolution, so I know it's not. But, yeah.
So are you just here full-time taking care of all these cats?
Yeah, this is my house. And, yeah, we've converted every room into one thing or another. Straight back there is our ICU, which really right now is just stuff. It's a supply room because our ICU devices.
I was like, I don't know where I'm going. There's a business name, but it might be your house.
It is my house. ET's my house.
I knew I was in the right place when I saw all those cat carriers.
We have a spay day this Friday. That's funny. We have 15 cats going up. Yeah, take a peek into the nursery. It's the room.
Where is that?
Right here. Right here.
Oh my goodness.
There's 2 doors, but yeah, there's, let's see here. I want to say 23 kittens in here and 4 mamas. One of them, which is that penned in area there, she just had 5 babies on Sunday. So that's why they are in there.
You're so cute.
Oh, they're adorable little freakish monsters.
That's you. Your hands are really, really full.
Yes, they are.
So crazy.
And we are on TikTok and YouTube. We try to be on YouTube every day.
I know my girlfriend joked, she's like, well, I was like, I guess I'm going to be on video. She's like, well, the algorithms love you, so her YouTube video will do great. I'm like, I think she's on it all the time.
Yeah, pretty much. Especially TikTok. TikTok's in the afternoon. Okay, so how I do it, I pull it back to the amount, and then I'll bring it. So she's supposed to be at 0.5, so you see it's a little bit more than that. once it's there,
Oh yeah, because you want to like push out the air.
yeah, you're going to be pushing out the air, which is also into the needle. So there's always just that little bit, and it's better to go a little bit more than a little bit less anyhow. But we also have this part of the plunger, which the other sizes of the
Yes, so
of the
you're almost
syringes
doing
don't.
like another half.
Yeah, but
But
then
then when you push it down,
so it pushes it almost all the way through here, but then it still has the needle, and that needle you
oh my
just
god, does that whole thing have to go into her?
yep.
Oh
There we
no, I don't think I'm gonna be able to do that.
Yeah, you will. I have confidence. It's gonna feel weird. Otherwise, yeah. If you're like,
God,
nope,
I just
it's
don't.
okay.
I'm
You can bring-
horrible at that kind of stuff.
Well, it's up to you. You can always bring her down, and I can do it every day. That's totally up to you. Again, it absorbs faster, which is why I suggest doing the injectable.
I might be a crazy person and just drive here every day.
That's fine. You're not the last person I help out. Actually, did the same thing.
I
And
just
for Barb to contact
I
me directly,
like-
usually tells me this is kind of a dire situation. So I'm going, okay.
yeah, I myself have been like made myself sick
treats.
over this, so
Is there any food restrictions or allergies that she
No.
has that you know of?
Mm-mm.
Okay. I'm just gonna get her a little plate of treats because usually they go one of two ways. They want a chewy toy or they want a plate of treats. Let's go through these ones. Oh, da, 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 da. So much fun.
hi baby.
Yeah, my moms are awesome.
You have the cutest
Learn
little,
how to
like,
give insulin
nose
shots to one of my cats.
mustache.
Well, awesome. That's totally a different thing. I don't deal with cats except for with the FIP. Cats'
Okay.
bodies are like aliens. Oh no, I'm reading the YouTube things. No, because people start asking me cat questions. Like, nope, I don't know. I'm a subject matter expert in neonate kittens. That's where my expertise lies. Once they become outside the neonates, I rely
I
on my
forgot we're
vets.
live. I've never been live.
A lot of people, it's funny when they come over and they're volunteering and I'm talking to the chat.
It's like, who are you talking to?
They're like, okay. It's like, no, ignore me. You're fine. I'm a little bit, odd.
Oh my goodness, hey, come back here.
Too funny. That's Penny.
Hey. I love your little nose brush.
She works on it every day. Very, very proper.
There you go. Now you warmed up to me.
Okay. Woohoo!
Puppy.
Now then, some people will say for the injections, you should give them gabapentin. I do not do that because gabapentin, one, it takes 2 hours for it to take effect, and then it's in their system for 8 to 12 hours. When it's just an injection that lasts a few seconds. Otherwise, they're just going to be drugged up, knocked out.
Yeah.
Nah, don't worry about it, especially if they have cerebral hypoplasia. But what I do is I shave the area and then I numb it with ice. I
Okay.
hold ice to it for a few seconds. And that tends to work rather well so far. No, unless you're Penny, who's melodramatic. But, okay, go ahead and bring your baby on up.
Okay, puppy.
Penny, you are just about as interested as can be. She's almost done with her observation period. So then she goes up for adoption.
Oh, Penny, you're so cute.
Now, how old is baby?
7 months.
Oh, yeah, you
Oh,
are
you-
skinny.
I know.
Oh, yeah, she's going to go, oh, treats? Okay,
Yeah,
let's put the
yeah,
treats
you-
right over
you
there.
get
You'll
those
get
after.
those afterwards.
Glad you're interested though, because
Let's do something.
what do you need me to do?
I'm going go ahead and hold on to her. I'm going to clip her nails. Because personally, I don't mind getting, bit or scratched, but if I can avoid it, I'd prefer to.
Yep, I've never done that before ever in my life for any of my. Do you know? Are you supposed to clip nails or just?
If you don't want them scratching up your furniture, I'm going to be polite. I'm going to take a piece of my mouth because I want to be
Mine's
like,
already,
"That's clear,
mine's
Mr.
already all scratched up.
No. If they have a habit of scratching or whatnot, it usually feels better for them too. Boom, there you go.
Mm.
I do paw nails usually once a month. Back, nails, I do
I'm scared
every
I
other
do
month.
like too much.
Oh, you know what? You see where it starts to turn kind of pink?
Mm-hmm.
That's what you want to avoid. So just right before that.
Oh, okay.
That's it. That's the quick. That's like us getting it right here.
Yeah.
Anything into that, it's going to hurt. Will it bleed? Yes. Will they bleed to death? No. That used to be a wives' tale. Some people still believe that.
Okay, puppy.
Okay. Are we going to be doing a hashtag the whole justice for Poppy for her haircut or what? They did that with me for Penny because I accidentally wobbled her haircut. And for months it was hashtag for Penny's hair.
I mean, she definitely needs a
Or whatever it
hashtag.
was.
What should her hashtag be?
What should her hashtag be, guys? Poppy survived FIP. Okay.
Oh, you're gonna do it, baby.
We're going to make you so pretty. You're going to look like a rocker. Okay, I will try to actually make this more even than I did Penny's. Penny's was bad.
What's she doing?
Nice medium hair. And it will definitely grow back. It will probably grow back a bit of a different color at first, maybe.
Yeah.
And then we'll go back to regular. It all
Okay.
depends on the kitty.
Yeah, she's so silver. It's very...
She's a blue.
Yeah, I know when it said cat type, I was like, I don't know, cat?
Hi, sweetheart. I know I'm taking your pretty hair. We just want to make sure
It's okay.
that it doesn't ulcerate because some medications will do that. It depends on the kitty. It depends on the meds, the combination, blah, blah, blah. And if you've got a kitty that develops ulcers, you don't want to stick the needle into an ulcer. That would hurt. So that's why we want to do this. Now, the way that they've been advancing medications, and you don't have to go through the vet's pharmacy either for the meds.
Yeah, I spent like $250. After spending like,
Yeah.
$1,700.
You can send me your email address,
Okay.
and I will send you this guide that I've put together for the humans. And I know that Barb would have given you their contacts as well for the FIP warriors. But I go through either Azul or Rose Harmony. And I think it's Azul. I don't remember which one.
Yeah, I had to have it shipped from like some Wedgwood. It's in like New Jersey.
Oh yeah, Wedgwood's expensive.
Yeah.
I am very familiar with Wedgwood. There's a few different.
But I guess at least I'll have it.
Well, yeah, you pay for overnight, but that doesn't mean it's gonna be.
I know. I was just like, I don't know when it's gonna be here. I don't want to wait till 9 p.m. tonight.
Azul is who I go through for
Come on, Papa.
the oral stuff for sure. Rose Harmony is the injectable one. You can get either one of them without a prescription through the FIP Warriors. It's just that it's one of those things where the FDA will not approve it if it's produced in large quantities because it's a compounded med. I know. She's just going to be very hip for a few months.
It's okay.
We had 3 kitties going through FIP treatment at the same time here. That was fun.
Yeah, look at her little bones.
Iris, yeah, she'll gain weight soon. Iris, she's jet black, and her fur came back black and white silver. It was just really cool with these stripes. I was like, dang girl, I want to shave all of you now just to make it look like that.
No.
It turned back to black. I was just going, wow. But it was so pretty. And we're doing both sides because I'm guessing, because of how thin she is, we're going to be doing this for a few more than just a couple of days. That, and we'll have it balanced.
That was my question. Like, since I have the oral coming, how long do you think we'll need to do the injections?
I tend to do the injections for 2 weeks no matter what.
Okay.
That's me. That's just me.
Okay.
Whether or not somebody takes that suggestion is up to them. Um,
Well, yeah, because I also read the thing that they sent me. You can't like switch back and forth, or it's not good to do that. Like, do like oral one day and then injection the next.
yeah, you don't want to do that, but at the same time, can you switch back to the injection? Sure. After so long, you could then switch again back to the oral, but it is not good for them to switch it, especially too soon. You don't want to prematurely switch them. My thing with her right now is make sure she's gaining weight.
No.
And her little
puppy.
I'm glad that they didn't drain her stomach
They did.
all the way.
No, he
Okay.
said he didn't want to do that because he was worried that it would hurt her.
Oh, it would hurt her.
Yeah.
That always I question.
I think he said he did like 80 milliliters though. There was so much in there.
Yeah. Where'd you take them?
Union Ave vet.
Interesting. More and more vets are doing the practice of the draining, and I'm going.
I know.
I
So
don't like
my
it.
girlfriend's cat had the same thing. I didn't know. I never knew what FIP was until this happened.
Most of the time, that's the way it is. Don't feel bad.
I know. I wish if I would have known you, I just would have had help.
But at the same time, do you really know what shingles is?
No.
Exactly. But that's a human thing.
Yeah.
What they got, okay, and we were talking about this, weren't we? Most cats are either exposed to, born with, or have caught the feline coronavirus. When they catch that, then it's part of them. It becomes part of their DNA.
Yeah.
Chickenpox is the same thing for humans. And as when under the right stressor, and only their bodies, it's not even them, their bodies will tell them what the right stressor is. Same thing with chickenpox inside of us. If we've had it before, it'll genetically mutate into shingles. Them, it'll genetically mutate into FIP. So it could have been anything.
Yeah.
When did you adopt her?
March from Oak Brook Cat Rescue.
Mm-hmm. Oh, I love Oak Brook. I work with the executive director all the time.
Yeah, they were great. So I'm like, I'm not blaming them.
No. It was just a fluke thing. Was there a recent change in the house other than that? I mean, March
No.
was 3 months ago.
She was the change, and I feel like I have a cat at home, but she was the only new change was bringing her into our home.
And that might have been it. And maybe she's had this for, the last couple of months, and it was just harder to tell.
Yeah.
Because you didn't know anything about it, and it's difficult to gauge on that, and that's okay. But yeah, I know about it. And I had 3 cats. One I was on my radar in December, and she didn't crash until February. Her blood work was fine until February.
It's okay,
It was wild. The other 2, totally under my radar. Didn't even catch it. One of them needed the blood transfusion. I was stunned. I was irritated with myself. Beat myself up to no end. Okay, so did you want to try to doing?
I don't know. I don't think so.
Okay.
I just don't think I can.
Nope, that's fine.
I've been like too upset over the past couple days.
I get it.
Maybe I can come tomorrow and learn, but
That's okay.
yeah.
So I'm going to start with the right shoulder. Right shoulder's right over
Oh yeah,
here.
you wrote it all down.
Yeah. So we're just going to rub this on there.
Is that just the ice?
Just ice.
Okay.
Just ice. And you're probably not going to notice a huge change for a couple of days. It could take anywhere from, what the hell's this bug doing in here? Anywhere from 2 days to a couple of weeks. I've never seen them go beyond 14 days actually. And all of a sudden there's like this remarkable change. Yeah, it's just.
Yeah, it'll slowly get better.
Mm-hmm. And then they get to the point where you're going, whoa. Of course, the oral medication makes it so much easier because then it's just putting it in their mouth.
Yeah.
Trying to do it around the same time every day.
Hey.
If you skip a dose on accident, just move on to the next one. If with the injections, if it goes out, if we don't get enough in, if we If she pulls out and it goes everywhere, then we just redo the entire injection. It's not like that's going to overdose them. In fact, the 2 of the 3 that I had to give them double doses for weeks, actually. Her, it was a few weeks just because she should have probably had a transfusion. But I was like, she's on the cusp. Okay, so go ahead. Oh, let's do this. Let's see which one she wants. Are you going to do that? Yeah, you're probably going to do that just fine.
What do you want me to do?
I'm just going to see if I can. Boom.
Was that easy?
That easy.
Oh.
You get her distracted, and usually it's okay. Unless you're that one. You are a pain in my ass. She made me feel horrible. I had to have a friend of mine come down, hold her. We both cried, and this is a full-grown man because she was tiny then too.
Oh, now you're moving on to the crunchy treats.
That's fine.
Hey, her eating anything right now makes me happy. So.
That's it. So whatever she wants, she gets, as long as it's okay for a cat.
I know. I did give her a little bit of fried chicken the other day.
Did you want
Oh, what's
a
that?
chew toy? I had one that didn't want the treats so much. She would, and she would be so angry about the injection. She'd be like, and we called it a tipper tantrum because her name was Tipsy. And then if she didn't want the treats, she would munch on one of these, and they're just chew toys for cats.
Oh my goodness! Thank you.
So that's number 1. If you want to come down tomorrow, and
I probably will come down tomorrow,
and then you try it.
Try it.
I'll tell you what. Tip on this: once you start the injection, commit. Don't sit there and go, oh
yeah. See,
oh,
it's like
you gotta just commit and go, because otherwise it's gonna tear you up.
Is it like? Does it matter? Like, are you putting it in like?
What you're doing?
You're just getting it in her skin. Like, it's not like you're going to a vein or anything.
No, you are definitely not going into a vein. You want to cut. You want to pull it up in a way. So tomorrow's going to be the hip.
Okay.
So basically, what you're doing.
Oh, you go
there.
Okay, shoulder. Okay, shoulder, hip, shoulder, shoulder. Okay.
Yeah, shoulder, hip,
Yeah.
hip, shoulder, hip, and whatever.
Okay.
Yeah. So you just pull it up and you try to get it in between the two. Now, if you go through it,
That'd be horrible.
no.
Okay.
Once you if you go through it, that's when you go whoops. But if you don't, you just try to go a little bit in, and usually they're like, oh,
Yeah, it just
Okay.
needs to be enough to stick it. Like,
Yep.
you're not sticking this whole thing in her body.
nope, you
Oh my
don't.
God,
It's
okay.
just yeah. And sometimes I wish they made the
Yeah.
gauge
It's
about half that size.
Yeah, it's so
but they don't.
long. Like, especially for these little itty bitty babies.
The 25 gauge, which is super thin, they get those in 1/2 inch. Everything else after that is 1 inch or 1.5, which is like stupid long. And I'm going, really? And it drives me a little batty, but it has to be the 20 because it's a thick medication.
Okay, so for
That's a
tomorrow,
big
should I plan on being here like around the same time?
Sure.
Okay.
That's
that
that's the best thing
Okay.
to do is try to stay within the same time frame.
Okay. Well, if that works for you, then I'll plan on being
And
here again
I
tomorrow.
will just go ahead and keep this right here, and that way you don't have to worry about bringing it back and forth and back and forth. You did good, Poppy.
Oh my goodness! Thank you so much.
You're
like,
very
I don't
welcome.
know.
It's okay.
It's been horrible.
And then yeah, I'll just put this on the fridge, and every day we'll weigh her. In fact, I could actually just weigh her again just to see.
Yeah, I'm curious how much she weighs if she lost more.
He's so cute. She
yeah,
did. She lost a little.
Yeah.
2.58 to no, you don't want that stuff. That stuff will give you a belly ache because that is for itty bitty babies. Okay, let's see here. If she wants to have some, I guess I could try. Yeah, she's still 5.5 pounds. Hold on a second. Let me see if she. I don't want her to eat that because that was somebody else's food. But...
Yeah. Oh. Poppy's full name is Poppy Seed Muffin. I was just reading some of the comments.
You guys broke your toy No, you just took it apart. Okay, let's see.
There, you got some. Hello, Penny.
Look at this. This is Royal Canin's mother baby cat food.
Okay.
You can get it at any store. Well, almost any store, I guess. I don't know.
Yeah, she's not eating any of her cat food right now.
And if she eats this, then yeah, I would kind of invest in that for a bit. It's high in fat.
Okay.
Penny, will you quit farting? Holy crap. I blamed Tim earlier. Oh my gosh. That was too funny.
Okay. Puppy, you ate a little. That's good. Here, I'll see the babies. There you go. Look it. We got more foods.
Okay. I heard this thing. But I hate that sweat.
Oh, yeah.
Yeah, just when you think
Okay,
you're done,
good job,
it's
Poppy.
not. So
You did
here is
so
Poppy.
good.
Poppy's going to be joining us every
I'm
day.
sorry,
for a
what
bit.
was your name?
Oh, my name's Shar.
Shar. I'm Amber.
Hi, Amber. Nice to meet you.
Are you ready to go? You did good. You did good. There's your mom.
I talked to so many people in the message. I'm like, I don't even know who I'm going to see right now. It's just like, I'm getting in the car and going to Lacey.
Yep.
You did so good, puppy.
There she is.
Little puppy girl. Oh, no. We got to
Yeah.
stand there. Sorry. Say bye to Penny. You'll see her tomorrow.
No, just because this is me being overprotective because I do this with almost every one of them. When you put her in the car, where do you put her? In the front or back?
Front.
Okay. Do you, by chance?
Buckle her up? Yes.
Okay. I would not
But-
put her in the front
Okay.
because if by chance somebody hits you, those airbags are going to deploy.
Oh,
That
my
will
God.
crush her.
Okay.
I would definitely put, even if she was in a hard carrier, it would do some damage. It would just make the hard
Yeah,
carrier
this
go
is
crazy.
just like nothing.
Yeah. The back, I would still belt her in somehow. But yeah,
Okay.
so many people instantly go right to the front.
Yeah,
It's like
I'm always like watching her.
my sister was in a head-on collision in December. She was transporting one of our cats to the vet, and the cat survived. It was shocking because my sister was in the hospital for a week and a half, but
Oh wow.
it was devastatingly horrible, and it was like wow. And had the cat been in the front, it would have just been even worse. So, and then she would have felt even worse because, as it is, I was able to just say instantly, "Hey, cat was found." Cat was found because she was worried about that. I was like, "It's okay."
Okay.
In and out of consciousness. Where's the cat? Oh,
I'm gonna
God.
look at these kittens one more time.
Oh,
It's so cute.
you got hashtags. Poppy's a fighter.
Oh, that's what I've been saying too. Actually, I've been saying she's a fighter.
There you
Poppy is
go.
a fighter.
Poppy's a fighter. There's your hashtag, baby.
Oh my gosh.
Like
little
it.
Cat wheels going. They're so cute.
I do the front seat and never thought of that. Oh, yeah. You know what? A lot of people do. I used to. And then I saw what happened and it was like, holy crap. And before that, I still buckled them in. But yeah, once I saw what happened to my sister's car, never again.
Thank you so
Crazy.
much.
You're very welcome, hon. We'll see you tomorrow. Drive safe. Of course, you can't control everybody else. So
Yeah. I will drive.
Bye,
Oh, sorry,
Poppy.
puppy.
There you go. Face plant. All right.
Oh my goodness, I feel so much better
Good.
already.
Good.
I've been so stressed out.
I
I
bet.
just wanted to like get the medicine in her, you know?
She's got it in her. It's gonna start working. Hopefully, we'll see something in the next couple of days, and then we'll be able to go. Yeah, she's eating on her own. She's doing everything well. Back to normal. That's when you know it's okay to start forward. Oh, what a sweetheart. And yeah, most people are absolutely terrified when they first come here. And usually, when they leave, they're a lot calmer, which is what I hope for, because the babies need them way more calm than usually when they first get here. However, I know with Blueberry's case, that one had waited too long. And I was really hoping to be able to help her. What I didn't know at that point was that, and I didn't even look at her HCT levels. I never asked for them after what had happened. But she probably needed a transfusion, and it went under everybody's radar. I don't know. So, there is Poppy's numbers. Her weight's probably not going to change much for tomorrow, but because she did drop some. I wish you guys could talk out loud. Anyways. Yeah. I don't know why you have such bad gas, girl, but my goodness, you tink. You don't just tink, you tank. Mm-hmm. So, I don't care how long she wants to come down and you do the injections. I'm down with it. That's fine. Anything to help the baby. I get to sterilize those. Okay, excuse me. Yeah, no, you're not going to get... No, we're not going to throw out of those treats right now. There we go. All right. Everybody, let's all do dishes together. Once I'm done with this, then we'll go into the kitten room. I just need to get some of this stuff under control. It drives me a little crazy. Oh, that's right. I still have to clean that. Yeah, damn it. The water fountain. It's not a thorough cleaning, it's just a minor cleaning. It was just cleaned and had new everything done on the 16th. How do I know it was on the 16th? Because that's why I do that. I write down the date on a piece of tape. That way I know when the last time I changed all the filters. Some people think I'm crazy. Some people think I'm micromanaging. It's not, because I'm actually, I don't want to sit here and waste a bunch of filters. I don't know when it was done. Or even worse, you don't know when it was done, so you still don't do it. That's not good. Good golly. We go through so many freaking plates. Oh, I'm glad that Tim got the litter boxes all done. That got really freaking hot. And I should know better. There we go. Yeah. Wow, really? Okay. So with these, once a month, I will totally take this thing apart. This is not me taking it totally apart. But I will take these out, I clean them out, rinse them off, all of that. But see, this comes apart, these come apart, this even comes apart. Right now I'm just going to clean it up because the filters had just been changed about a week ago. I need to get other water fountains in there. I don't know how well they're going to do with the new style one that I got from TikTok Shop. I could certainly try it. Oh, there they are. Those ones don't require filters at all. It's really bizarre. It has this chamber where the used water where they're licking, if it doesn't get drank, then it goes into this chamber. Kind of cool. But you still have to wash the tops of it every now and again. So you still have to keep tabs of it. You can get it where it connects to an app on your phone so you know when it's low on water or not. I know Kathy R. loves hers. Gets it all nice and clean, make sure everything's good. And look at this. I mean, there's so much crap and debris in there. Just from food. And probably because this is from the nursery, there's probably litter in there too, because kittens will get litter on their feet and then they go and walk in the fountains. So, yeah, there's that. I might just change it around and put the mama's fountain back out on the floor and put the new fountain in with the Mama S'mores. This is a regular kind of one where it can break down into a million pieces. I'll show you the other one. Okay. Nothing like, oh, geez, Char. Nothing like kittens arguing in there. I can hear them. Okay, that one's put together. By the way, where there's a max line, go just below that. Don't ever go right to the max line. The chances of you getting water in the mechanisms that are not supposed to have water in them are pretty darn high if you have it sloshing around at all. And I'm leaving the tape the same because I still haven't changed out those filters because they only have to be changed out once a month. Really, if you take care of these once a month, that's it. Okay, I'm going to throw this back in there. I'll show you the new filter in just a second, or the water fountain. Okay. Here it is. Done. It comes with everything you need. The plug, well, the wire, the plug. This goes on the top, you'll see that. This goes near, yeah, you'll see where that goes. Then it has extra, these are the only filters. Okay. One thing I do want to point out, this thing looks pretty cool. And when it goes on, it's all pretty and it's clean and all of that. Just remember, after a couple of weeks, these have to be popped out because it'll sit right on top. It needs to be popped off of there. Oh, thank you, Dizzy Dizzy, for the floating heart. It has to be popped off and cleaned underneath there and on the fountain itself. If you don't, there's going to be mildew and all sorts of crap growing. That's not good. Okay. Pushing it back further. There we go. Now then, when it is empty, when it is empty, you can hold it like this. There's a little handle here. Once it's full, trust me when I say, don't just grab it here and think you can hold it here. It is a little harder than that, trying to hold the two together. You will end up going loop. And there's these magnets that hold it together that gives you this false sense of security. Here's another thing that I do not like about the design. By the way, this goes like that once you have it put together. But right now, we still have to get it put this thing on. Oh, I didn't realize it has a second one. So this is a second one. There's one right here. And it already has a black spongy dealy thingy. But if you didn't see this, this is what I'm talking about. Under here and under here, you've got to keep it clean. Otherwise, it's just going to have mildew galore. This is the flaw that I think they should have fixed. I don't understand this. As it fills up, there's a little floaty thing right there. See that? Problem is, that's generally in the front of, yeah. If you have it turned around, it's not like you can turn this around. If you have it this way, and usually this part's on against the wall or close to the wall, this way, you might be able to see it if you're back here, but if you're standing up also, you won't see it. If you're off to the side, you might see it. That's what it just kind of like, wow, what the fluff? So I do a couple of things. One, the fill line is right here. You can kind of see it. Why they didn't just make it into a better color is beyond me. And it says right here, it's good for 3 liters. Oops. That way I know where the max fill line is and where the minimum fill line is. I really don't care about the rest of the crap. I care to be able to see it. That's my big deal. Okay. While I'm cleaning this up, I'll clean up this too, but not yet. I am going to let it charge. It is cordless. You can get this on Amazon or just about anywhere else. So far, the cheapest place I found it is on TikTok Shop. And you don't even have to use that cord. You can use your phone's charging cord because it's just, you know, the typical charger. It also has instructions. They're almost written in English. What gets me is this. It says, yeah, it still says it. Float ball missing or inverted. Make full water, not alarm or overflow. Yeah, their fluentness in English still needs work. But, you know, hey, they're getting there. I can tell you, they spoke better English there than I can Chinese, so... Okay, there's that. This one doesn't need to be. This is for the overflow, remember. This, anytime this gets filled up, you dump it. This, I'm big on. Clean water, clean water. Cool, clean water. So you put a piece of tape on that. So right now the battery is 2 dots full out of 4, so it's going to be a little bit. But hey. Now Tim and I both have tested the ability to, lift the whole thing up when this side's full. Learn from the wise. Don't do it. Hold it correctly. Don't use just the handle, and certainly make sure you're. In fact, it's sometimes best just to take this one in there first. And I think I'm going to go this direction. It's the 24th today. I need to get the food up and get Snowball looking like himself again. So in a moment, I'm going to just jump off of here. Three liters is a lot. I might see how well the kittens do with it. Now, if I put it in there right now, without the lid thing, disaster. Oh, cool. Thank you. Thanks, Jill. She ordered some of these. They're little pet hammocks for the catio. Very cool. Let me see if I've heard from them yet. Nope. Oh, if this part becomes too full, there's a red light that lights up on the panel on top of the fountain. That I didn't know. So somewhere, and by the way, there's a module, mode 1, mode 2. I really should read what those are. I genuinely don't. mode button. Mode button, mode 1, continuous recirculating water flow, only for AC power supply. Okay. Sensor activated, so when it senses that there's an animal nearby, that's when the water flows. That's on mode 2. Makes sense. Short press will switch between modes. Long press in mode 1. Press and hold for 2 seconds will switch between the 24-hour and the 48-hour automatic drainage setting. Huh. Yeah, I don't think that I would ever use that because we've got too many kitties here. So we'll just be on constant mode 2. Red light indicator. Power button indicates wastewater. Oh, goes around the red, this area. That one turns it on. Red light says wastewater is full. Empty and clean wastewater tank properly. Oh, that's the mode 1. And the mode red, if you see a red light on the mode, it indicates that the clean water tank is low on water. Please wash and clean the tank and refill it with water. Huh, I didn't know that. Very cool. Helpful. Okay. All right, I'm going to go ahead and finish this up. Get it into the... I'm not going to put soap in here right now because of the filter. Just rinsing it off, big deal. Oh, it smells like a nice summer day. Oh my God, it smells so good. Okay. I'm going to... How am I going to do this? How am I going to do this? Without tripping over the kittens. I'm going to wait till Tim's down. That's what I'm going to do. So never mind. I'm going to keep charging this. Okay. I'm going to get going because I've got to get the food up and let Snowball out. And basically just check on him and make sure his eyes are okay. Hello from Nashville, Tennessee. Hello from the Pacific Northwest. Yeah, I'm not sure. I don't know if these ones connect to the app or not. I'd have to look. Probably not, because it was probably one of those things where it was cheaper and one less thing on my phone. So we'll see. Anyhow, have a wonderful day. We'll see you tomorrow. And you use mode 2. That to me just makes sense, but otherwise you have to have it plugged in all the time. Have a wonderful day. Love yourself, love each other, be kind to yourself and be kind to others. Get your animals spayed or neutered. Get them and keep them vaccinated. Take care of them like they're your children. Have a wonderful day. Bye. Thank you.